Waseem Hussain. I belong to Rajouri region in Jammu and Kashmir state. I have done my DNB cardiology from Fortis Hospital, Mohali in 2020. Today I will be talking about latest updates in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular disease, which affects around 45% people in 40 to 69 years of age group. Hypertension or raised blood pressure is among the most important risk factors for cardiovascular diseases. However, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. I will be talking about particularly in India. This prevalence of hypertension has gone up in last 30 years to 38% in men and 32% in women. From the earlier 29%, earlier it was 29% the prevalence, now it has increased to 38% in men. So around 9% hike in this percentage, in this prevalence among the men, and around 1%, 1 to 2% among the females in last few years, in last 30 years. So there are many factors which has led to all these things. First is the not detecting hypertension at the right time and then ignoring the treatment. There are many factors for that. Additionally, over 62% of men and more than 53% of women living with hypertension, they don't get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women. If there are 5 women, so only 1 woman with hypertension is getting treatment. These are the WHO data recently. Then I will talk about the International Society of Hypertension, what they have released in 2020 Global Hypertension Practice Guidelines. In those guidelines, they have explained 2 or 3 very important things, that when the treatment should be started, when in that divided that into 3 stages, stage 1 hypertension and stage 2 hypertension. In stage 1 hypertension, those people without any significant cardiovascular risks, they should be monitored for next 6 months to start treatment or not to start treatment. Another thing that WHO has in the recent guidelines, they have mentioned about the ambulatory blood pressure monitoring. What the blood pressure which we monitor in the office is usually not the only the guiding should guide us for the treatment. We should in those patients who have low cardiovascular risk factors, we should monitor it for next 6 months. And if there is still significant blood pressure is more than 140 systolic and diastolic BP is more than 90, then we should definitely start treatment. Then another very important thing has come out recently, that beta blockers, particularly metoprolol, that has led to a significant decrease in the acute respiratory distress syndrome, and it has led to decrease in the lung inflammation during this COVID-19 era. So this drug has come out to be of significant importance in controlling blood pressure as well as in reducing the inflammation in the lungs. So lowering systolic blood pressure target to 110 or less than 130 millimeter of mercury range substantially reduces cardiovascular adverse effects in this STEP randomized trial. With respect to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure monitoring control, the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on office BP, but also on out of office, means ambulatory BP monitoring. Another thing in 2018 has come that is of also very important, that valsartan and losartan, olmesartan, irbesartan, these drugs which come under ARB category, they have NDMA, a product which is found to be carcinogenic. And the last HYGEA study represents the largest study that tested nighttime antihypertensive treatment. In this study, they say that if the usual dose of antihypertensive be taken before bedtime, that will lead to decrease in the blood pressure while the person is sleeping. Nighttime blood pressure will be controlled, and that is more important for the cardiovascular outcome. for the primary cardiovascular outcome that has shown significant results. And now I will talk about, give you some time for to start, how to start the antihypertensive treatment, antihypertensive management. First is initially should preferably ARB or ACE inhibitors, angiotensin receptor blocker or ACE inhibitors should be started. Then, and they also, recent guidelines also mentioned that additive therapy, combination therapy is better than single therapy for the control of blood pressure. Thank you so much.